with all due respect.
Hey, we're Josh Ortegon and Greg Gaines, and this is With All Due Respect, the show where we keep it real about health, fitness, and performance. From weight loss to sports development, we're covering the conversations that matter.
Follow us on Instagram at Phenom Fitness, PHNM Fitness, and visit www.phenomfit.com to check out our training programs, coaching, and gear built for real results. Let's get into it.
All right, episode 80. And we got Mike back on. There's been some changes. Mike, we have been waiting for this point for you for quite a while. I think we've been talking 2 years about Mike with PA school, and you were working in ER. Were you working in ER?
Yeah. Mm-hmm.
Which just sounds stressful. And now, and I feel like I don't even have to introduce you to people now anymore. I see even like on your social, you'll post something and a bunch of people that are in their group are already following you and they're friends with you. They're commenting like everybody's big happy family now. We don't even need to do it. But the question has always been, hey, how can I do more with Mike?
Yeah.
Right? Because we've always believed in practicing inside our scope, and there are things that I can't do, we can't do. Even though I will say I've gotten pretty good with blood work.
Same.
And I will say the reason I've gotten pretty good with blood work, Mike, is because everybody has the same problems.
Yeah.
Is that fair to say?
At least in our community,
Yeah.
for sure.
Yeah. You know, if somebody comes to me and is like, hey, my right blood cell counts through the roof, I'm like, I got cancer. But you know what I'm saying? Like, but I mean, for the most part,
Yeah.
most people that come to get our services, a lot of the labs, especially the men labs, look very similar. The women labs look very similar.
Yeah.
I can almost tell. I had a guy come in that had super, super low cholesterol.
Mm-hmm.
And I was like, man, I wonder what your testosterone level's like
Mm-hmm.
in the tank.
Mm-hmm.
In the tank, testosterone level, right?
We went to the University of Mike, I feel like.
Yeah, we went to
That's what we
Mike
did.
University.
I don't know about that.
And it's just been able and see like inflammation markers, right? High
Yeah.
cholesterol, blood sugars off. You see all those signs of inflammation.
Yep.
So I've been able to see people and been like, yeah. And you know what? It's been interesting, Mike, through this education too. We talk about supplements a lot.
Mm-hmm.
And I'm going to be honest, I used to be a little bit skeptic about like, there's things that most people need. We don't need to see blood work. There's most things people need with supplements. Everybody needs this and this. Everybody should take this. But man, seeing people's blood work come through, you get an inside view of like, no, you don't need vitamin D, or yes, you really need vitamin D,
Mm-hmm.
right? Or fish oils and things like that. So, you're now in a place that people can come to you.
Mm-hmm.
And give me this right. Do you guys do telehealth at all?
We do. It's currently on pause because the
Okay.
government shut down, but
Oh,
as
yeah,
soon
yeah.
as that starts back up, everything's full throttle. That could be tomorrow, next month. Who knows?
Who knows?
But they have to come see you first in person.
Has to be in person, but even if you live in Florida, North Carolina, Virginia, if you come into town, establish in person, from there on out, we can do telehealth.
Man, isn't that
Yeah, that's
wonderful?
awesome.
Isn't that awesome? Right. And for most people, I've got a few people on the hook to come see you. Charleston, Columbia here. They're like, Greenville, it's easy.
Mm-hmm.
2 hours. I just saw a couple of people from Columbia yesterday, actually.
Yeah. And then we can do telehealth. I'm like, yeah, and it's different. Um, so tell us a little bit about where you're at, what the type of patient you're seeing, and then I really want to know if there's any surprises for you so far in practice.
Yeah, so it's a traditional primary care clinic, but my supervising physician is excellent. He's a team doc for a couple of the local semi-professional sports teams. We cover a lot of the local sporting events, the BMW Pro-Am golf tournament. So he's very progressive. He's very forward-thinking. Does a lot of sports med, does a lot of hormone replacement, males,
Mhm.
some females. But he's very open to additional testing, to bring in additional things to the office that we can utilize to help as many people as possible. So we do everything from, hey, I cut my finger open with an X-Acto knife. Can you stitch me back up? To, hey, I'm 38 and I'm wondering if I have low testosterone because I'm a male and I'm really tired. So run the gamut all the way throughout that. But we also do like chronic disease management, somebody who's got COPD, asthma, type 2 diabetes. However, when they come to me, the first conversation we have is, are you content with all the medicine you're on? If the answer is no, that opens up a whole other realm of possibilities that many patients tell me, hey, why didn't anybody else ever talk to me about this before? Why has my doctor never talked to me about nutrition? What is a carbohydrate? How do I even count those? And what foods are they in? So that's at least the different spin on things that I tend to take. Um, Within that realm, we've also built out an online platform that allows people to order labs at cost. So there's a number of legal concerns with providers giving patients access to labs. This is not through me. I'm not signing off on any of these labs. There's no interpretation with these labs. It's just a way for people to order labs at cost, both specialty and regular labs. So stool samples, saliva samples, and blood work. And so I will share that resource with the group. It's in there as well, but people can use this link, access it. You can get phlebotomy come to your house to do the draw. You can go
What? I
somewhere.
don't got to leave the house. Gray knows that. If I don't got to leave the house,
It's simple. It's all
what?
done for
That would
you.
actually be awesome too, because you know how I feel about getting my blood work done.
Exactly.
Mike, they don't. I don't have
Yep.
to leave the house. I've been looking at a massage therapist recently, and someone's like, "Yeah, I got someone to come to your home." I'm like, "I'm in." He goes, "Want to know how much it costs?" I go,
Sign
"Don't
me up.
care."
You are literally going to get to the point where you never leave your house ever again.
Yes, man. Howard Hughes.
Yep. Yep.
Yeah.
For
So
sure.
the online platform, Mike, the blood work thing is so important and so big. I recently had a friend of mine go through his doctor to get hormone testing done and get the lab work done. $1,500.
Yeah.
Yeah,
So let me share my
crazy.
screen with y'all real quick, just so I can show you what
Let me
this is
make sure
actually
you,
going to
let me
look
make sure
like.
you can do it.
Okay.
I think our settings are on.
I can send a request here.
Did that work?
Let's see if that works here. Can y'all see it?
Yahtzee. Yep.
Yep.
All right, perfect. So somebody goes to the website. This is what it's going to look like. So let me get this out of the way too. So this is what it's going to look like for everybody. And so you can look through here. This is a comprehensive male,
What?
comprehensive female panel. I've got
That's
a stool
awesome.
panel on here that I use with a lot of patients that looks at both beneficial as well as pathogenic organisms, looks at calprotectin, inflammatory markers, digestive markers, a couple markers for fungal issues, candida, H. pylori, intestinal permeability. So that's on there. You can do a salivary cortisol assay. That's a 4-point salivary swab at home. You can just do general blood labs with CBC, chem, vitamin D. Everybody's like, oh my gosh, I got charged $250 for vitamin D at my doctor. Guess what? It's $21 at cost. You literally will just say, hey, I want this lab. I added it to my cart, and you're done. You check out. Rupa walks you through everything from a customer service perspective. You got questions on how do I get this drawn? Where do I go? They take care of everything. You can call them, you can email them, you can message them. It gives you all sorts of instructions on how to complete this, what you need to do for prep. So that's for every single lab, including the stool profile. There's certain things you can and cannot do beforehand. That's all included here. There's certain things you have to be off of. For
Oh
example,
my
here's
gosh.
all the biomarkers. So this is everything that's tested, all the different fungal species, parasitic, bacterial. I mean,
That's like 500 things.
yeah, it's a truckload. So this is the stool test that I prefer. It is both PCR, culture, and microscopy. So it's three different levels of verification as compared to something like a GI map that you guys have probably seen. Everybody's hawking now, especially online.
Yeah.
Um, so A1Cs, this is a full thyroid panel. If somebody says, I'm convinced my thyroid's a problem,
$52 for a full thyroid
$52.
Crazy.
panel?
Here's thyroid or testosterone, lipids, and then this is a this is kind of a specialty. It tells you a lot of different things about metabolism, but also we'll look at fatty acid ratios, so omega-3 to 6, and then also everything from like you eat saturated fat, but how many 18 versus 21 hydrocarbon fatty acids are you ingesting? It gives you heavy metals. It breaks down different types of amino acids. Um, so if it's somebody that really wants to go down the rabbit hole and really go in depth, I mean, you're looking at probably double the amount of markers on the other test, but this will tell you a significant amount with basically any micronutrient, CoQ10, zinc, selenium, all those things. So those are all on here. If someone says, hey, well, the lab that I'm looking for is not on here, can you add it? The answer is yes, unless it's something super specialized, like you want a lab for, I don't know, you're concerned that you might have cancer and you're going to want run like a serum protein electrophoresis. Like I'm not going to put that on there because if it's positive, you need follow up. But the basics, if somebody just wants to go and check thyroid, check adrenals, check testosterone, it's all on there. I'm not gatekeeping. Nobody else is gatekeeping. You can go and buy it right now, get the results sent straight to you. They don't come to me. So there's no interpretation. I don't see any of those results. It's all HIPAA compliant. I'm not involved.
So the reason this is
Wow.
important, client of mine went to her doctor, got her blood work done. She thought she was going to get an email with all the blood work. And this is like a cash pay hormone guy.
Mhm.
Well, they have a portal. All the blood work is on the portal. If she is ever not a patient, she no longer has access to the portal. She no longer has access to that. And that is horse, I want to curse. That's crappy because that's my blood work.
Correct.
Mhm.
But the moment she decides not to be that guy's patient, she doesn't have access to the portal. You don't have access to previous blood work anymore. That sucks. That pissed me off.
There might be a little bit of a legal issue there. I'm not a lawyer, but from kind of a
You
HIPAA
should
standpoint and
you
a few
should be
other
able to
things.
say that's my blood work. I want all of it on print.
Yeah.
Yeah. But she
Can
just
you
noticed
can you download it from the portal though?
no, there's just no place. It all pops on the portal. And that's one thing I told her to ask was, can you make sure when you're not a patient of this guy that you can get all your, because it didn't come like, I've had people send me their blood work and it's just, they just send me the file,
Mhm.
right? So,
She can also ask and say, hey, in the future, if I need to transfer to another doctor or specialist, can I have a copy of my medical
yeah,
records?
yeah, you should
And
be able to get all that, right?
they have to.
I saw
Yeah.
your free and total testosterone was $10.
Hmm.
That's
Yep.
so crazy.
I might get it tested every week just for clout.
Just to see.
Well, it's the type of thing too, like sometimes patients will say, well, my doctor won't run this test. And it's kind of like, all right, here's the link. If you want to run it, you want a vitamin D, it's $20. Go check it. You won't run it. Let's say they only run it once a year. Well, I tell people test it in the spring when you're coming out of winter, and then test it in the fall when you're coming out of summer and see, do I need 1,000 IUs over the summer? And then do I need 5,000 in the winter or vice versa? Well, it's $20. You can check it yourself.
Yeah. Rachel's vitamin D was 19.
Yep.
That's what I'm experiencing a lot with women like 40 to 60s. It's vitamin D. A lot of them, it's vitamin D.
Now, the key with that too is you need magnesium to actually support vitamin D
Right.
metabolism. So
Right.
sometimes people will be like, oh, I've taken vitamin D. It doesn't do anything for me. My levels never go up. Right. And so we need the other cofactors and we need to have a gallbladder that actually squirts out bile so we can break down the fat soluble vitamins. So these are the other pieces too that
Well, what if somebody doesn't have a
I
gallbladder?
was just about to ask that.
so usually you'll get an upregulation of the liver dumping more bile, but then sometimes you'll get dumping syndrome where people will get diarrhea. So then you need to make sure that you work kind of higher up the food chain to support pancreatic enzyme production, hydrochloric acid production, so you don't just get this huge bile rush. And sometimes they'll even need, like the bile will get a little sludgy. So they'll need actually like they're called cholagogues. So they're things that support bile flow. So like beets and dandelion and
Yeah.
some of these other compounds.
Okay.
So we can post that link to the group and we can hand that link to clients
Mhm.
and be like, hey, go get it. And then when you get your results, we'll talk about it. Or you go see Mike and Mike can talk to you about it. It's all yours. You own it. So I've had a lot of people before you were using Ultra Labs. I've
Mhm.
had 3 or 4 people go to Ultra Labs and get the male panel for like 360.
I was gonna say you can do that, but basically whatever I pay for labs is what's on this website.
Yeah, and
So
that's what I noticed. Yeah. So yeah,
as a medical provider, I can't make money on labs legally. So just know anything that's on there, there's no upcharge. I see
I
zero
love, man,
cents.
that's so awesome.
It is
because
awesome.
what it does allow people to do is to get labs as often as they can,
Mhm.
so they can see numbers and change as often as they can. I'll give you guys just a testimony for our people. Um, ever since Rachel comes, ever since she gave birth to Asher, they gave her an epidural, and she claims it's messed up her back ever since. Okay, I don't know. That's just what she says. And we got our blood work, and Mike looked at it and went and had us go to Thorne and get stuff for her, vitamin D, curcumin, a boatload of fish oil,
Mhm.
um, magnesium. I think those are the four.
Mhm. Simple.
And she was dead set on consistent with it. And I don't think she's taken ibuprofen for her back in 3 months.
That's
And it was
awesome.
a regular ibuprofen taking situation for
Mhm.
her. And it's crazy. It happened like 2 weeks into it. She just goes, I haven't taken ibuprofen for 2 weeks. So I didn't think about it. So, I mean, it brings up two things. One, the importance of blood work,
Hmm.
and two, the importance of a good supplement company, right? Like, we could have gone to Walmart that night and walked into the vitamin section and bought something and bring it back. And people are always a little bit pushed back when they're like, hey, should I take this supplement? And it's like, I picked it up at CVS and it's this. And I'm like, I mean, you can, but I can't make any promises for a product that you
Yeah.
bought at CVS at 10 o'clock at night. Right? You know what I'm saying?
Yeah.
Um, so the importance of getting blood work and then having the right supplement company. Mike, that's a really big resource. People don't know how important that resource you just put up is until you go to your doctor and you're like a buddy of mine who spent $1,500 to get all his labs run.
I
Hmm.
have, so I have a few physicians that are patients, and I tell them about these resources, and they're like, "Oh, I've spent thousands of dollars on my own labs to figure this out, and I could have established my own accounts as a physician and just ordered what I wanted." And I was like, "Yeah, I've been doing that the whole time I was in PA school, and now I do it for friends and for family. Like, it's not rocket science."
Yeah, man, that's so important to have access. I mean, the people that have gotten their blood work and they've come back to me and been like, no way. That's not, it can't be true.
I think it's important
Oh,
too. Like, how many women have y'all talked to that they're like, "Oh, my doctor won't run a full thyroid panel. They only run a TSH." And it's like,
mhm,
all right, well, 50
So
bucks.
many.
50
Hmm.
bucks and you
mhm.
get everything. Free T3, free T4, reverse T3, antibodies, all of it.
Yeah. Yeah. Have you seen, I don't know if it's true. I don't know how much of it is politics, whatever, but they're taking the warning labels off HRT for women. Have you seen some of that that's come out now?
Hmm.
Um, some of the um warnings and the apparently it's been hard for women to get HRT. It's been a very hard process for women. Apparently there's a lot of warnings on the labels and doctors that won't mess with it or touch it.
Mm.
I had a couple people, actually a friend of a kid I used to train, his mom one time emailed me with this long story about her, how hard it's been for her to find doctors to prescribe the progesterone and, the HRT or the estrogen she needed. And she's 50 years old and, how hard it was. And they came out there to try to take the warning labels to make it easier for women to go through doctors to get. I've never experienced that. I mean, Rachel didn't have a problem with that. But apparently, I mean, I tell you this, it ain't hard to get HRT for dudes.
Mhm.
Hmm.
That is easy.
Yeah.
That is, I mean, they'll sign off on 150, 200 milligrams a week for a dude in a second.
Mhm.
Why do you think that is? Like, why is there such a difference?
Some of it, I mean, I've seen at least some of it may be compounding versus normal pharmacies. I've sent things to normal pharmacies. I sent in vitamin D3 K2. And the pharmacist was like, "Well, I've never heard of this. What's vitamin K2?" And I was like, "Actually, I'll send it to another
Move.
pharmacy."
Yeah, Mike. Right. Moving on.
Yeah, like I don't have time for this, sir. It's
Yeah,
8:30 in the morning. Like I got patients to see.
yeah, yeah.
And so I sent things like that in. I sent in magnesium glycinate. The pharmacy's like, "We don't carry that. We don't have access to it." I'm like, a pharmacy with unlimited resources can't get magnesium glycinate. Either you're lying or you're a little incompetent. One of the two. Like I
Yeah,
don't know
yeah,
which
yeah,
one it
yeah, yeah,
is.
yeah.
So I've had things like that happen, but I know with compounding pharmacies, I haven't had anybody that's told me they've had difficulty with getting the HRT meds, even for women. So I
Yeah,
think it may be some of that too.
pharmacies. Yeah, we've dealt with some of that with Rachel. Yeah. Um, one of the things that always gets me is and you can maybe educate me on this. Every guy that gets testosterone, they give them an automatic anti-estrogen. And they're like, and a buddy hit me up and was like, "Hey, I got my TRT, but they told me to take 1 tab of Arimidex a week." And dude, 1 tab of Arimidex is a lot. That's a lot. I mean, it'll tank your estrogen.
Hmm.
And I was like, "Hey, I'm not. This is a good friend of mine, so I can tell him like, I'm not giving him doctor advice, right?"
Right, right.
And I'm like, "Hey, man, I would probably pump the brakes on some of that anti-estrogen until you get your second blood lab, your work done, because one, that's pretty rough on the liver.
Hmm.
Two, 1 tab a week is pretty. They're making a general statement here of just giving you 1 tab a week. And three, you take your estrogen hard. You're dealing with a lot of things. And I had a friend of mine just recently that quit taking it, and joint pain started improving, and sleep started improving. And they just give you that blanket 1 milligram or whatever, 1 tab of take it once a week. And I'm like, first of all, cut it in half and take it Monday, Thursday, if you're going to take the full one. But wait until you get your second one, because the automatic dosage of anti-estrogen, I think, is a generalization.
Hmm.
Let's pump the brakes, right? Because you dry out your estrogen as a dude. That's one of those things that it's one of those things that a lot of dudes will be like, "Well, I need my estrogen as low as possible." So wait, no, you don't.
Well,
No, you
you can
don't.
kiss your brain goodbye if you're
Yeah,
trying to
yeah,
drive your estrogen out the window.
yeah, yeah,
So.
yeah. That's
Yeah,
one of the
and
things
I
I've seen.
mean, I know everybody's slightly different in terms of the way that they were taught or the way they prefer things. Some docs will give like an anastrozole instead of a Arimidex,
Hmm.
um, and one's kind of inhibiting the enzyme of aromatase, and the other one's working in a slightly different mechanism. Well, the first thing is we need to assess total estrogens, not just estradiol.
Yep.
So that's kind of the one tricky piece where people will run an estradiol and be like, "Oh, your estradiol's up. We definitely need to give you an anti-estrogen." Well, except you have estrone and you have estriol. And so they're each cleared through kind of different pathways. You have the 2OH, the 4OH, and the 16OH pathways. And so some are beneficial pathways and some are more pro-carcinogenic pathways. So you can really assess that with a Dutch test. You don't have to go down that route with everybody on TRT. But the point is, just checking one estrogen out of three doesn't tell you the total estrogen load. And everyone is important for different roles. So if your total estrogens is high, rather than just giving you an anti-estrogen, we should probably talk about why you're overconverting and maybe take your dose down, or figure out why your aromatase activity is so high. Because if you're smashing wine and smoking blunts and going on the weekends and partying with friends and you have a really high level of adipose fat, yeah, I'm going to just convert all your TRT into estrogen and it's not going to help anybody. So that's really where it kind of comes back to, if somebody's getting TRT and it's not just like a, hey, we're handing this out to everybody sort of phenomenon, that's really assessing what are the other micronutrients we need to inhibit aromatase activity? What are the other things that we need to support clearance of estrogen? Because that's a big piece of this puzzle that we talked about with liver metabolism and all those other things too. And I haven't seen too many people addressing all those things together.
Yeah, we've talked about clearing estrogen and your body's especially a female's ability to clear estrogen
Mhm.
efficiently. I can't remember what it was tied to with a client of mine. Her ability to clear estrogen.
Usually, if they're high estrogen, they have fibrous cystic breast tissue, uterine fibroids, really heavy periods, heavy flow,
Yeah,
those sort of
yeah,
things. Really
yeah,
moody.
yeah. High, and she did. She had a really high estrogen, and they started doing some things to help clear the estrogen.
I think this
Um,
is the one that you and I sat down and talked to,
I,
and she was using a ton of plastic bottles and plastic Tupperware, and she changed
yeah,
that in her makeup, and her periods got better.
yeah, yeah, yeah. Do you remember that?
Oof.
You remember that?
Yeah.
Isn't that crazy? Isn't
Yeah.
that crazy? Yeah, Michael. At one time, we had a client and just talked about her story, and he
And full
goes,
disclosure, this was before I was in PA school.
yeah, yeah,
I
yeah. It was a long
wasn't I
time ago.
wasn't a
Yeah,
medical
and we were just
provider. We
having a
just talked this person
we were
had a
just having a
conversation.
conversation, just trying to have a conversation with this girl.
Yeah.
Yeah. And Mike, out of the blue, after he goes, "Have you ever been exposed to like mold or asbestos?" She goes,
Mhm.
yeah, I worked in a thing for years, and I was always worried about because they were clearing asbestos and all this mold in my office building and all that kind of stuff. And then she goes, that's kind of like when all of this started happening. And we like, well, you know, guess what, right? Um, one of the questions we had, and I'm glad we took care of, and we will post with this post like how to get a hold of you, how to contact you, that lab link, um, all of that stuff, so people can start coming to see you because uh, everybody knows that has listened to Mike knows that this is such a different way of dealing with health and disease and sickness than what most people are seeing in everyday practice. I
Mhm.
have friends, Mike, that get labs and can't get 15 minutes to get their labs explained and have contacted me. I got my labs and I got them and I was looking at them, but I don't have a doctor's appointment for another month and I don't know what's going on. And they're friends of mine. So we look at it. They just call me and we'll Zoom or something. Just throw them, let's just look at it. I'm not a doctor, but I can give you some help as a friend.
Right.
Right.
Mhm.
And they're frustrated because they're just like, how come nobody's talking to me? They're not talking to me. Right? I got no conversation. Right? It's like, and I don't have anything about health, anything about wellness. I have a friend that just recently, he has arterial, the arterial cholesterol is high. Not
Oh, like
calcium.
calcium score?
Yeah, calcium score was high for his age. It was a 31. He's a
Hmm.
mid 30s guy,
Hmm.
and really good friend. I've known the family forever, and he got on the internet and started freaking out. And he's a big, strong, athletic guy. He played college football. He's healthy. We went through lifestyle. Um, and just the doctor was like, "Hey, it's not great. It's not good. It's not horrible. This is not a death sentence, but you definitely need to address all the things that you can control. You need to control those." And the guy talked to him about the Mediterranean diet and getting healthy in zone two, zone three cardio.
Hmm.
And this doctor, I'm like, wait, wait, who's this doctor? He goes, it's my heart doctor. We
Good.
actually sat down and had this. I said, dude, that's so awesome that your cardiologist, because he went to cardiologist after he got the score because he's like
Right.
concerned.
Right.
And come to find out it's genetic. His mom has a real high score, but like the doctor sat and talked to him about exercise, health, zone two. Um, I told him to go buy Peter Attia's book,
Mm-hmm.
like strength training, how to increase the fat, look at these kind of diets. And I was so refreshed that a
Hmm.
doctor sat time and cared for him like that. This is the kind of care that we're talking about with
Mhm.
people that you're doing, and it's completely different. Ever since we've had this podcast, Mike, the number of people that have contacted me about their frustrations
Hmm.
with the system. Um, and anytime there's enough people frustrated, capitalism tends to find its own little niche to help those people, right? Like there's a need, and you're meeting those needs. So we will post all that. I wanted to address people that came on and ask some questions. We've talked about the HRT.
Hmm.
And the guy's like, are there things that I should be concerned of how do I want to start? And we start with blood work. And we always start with like lifestyle change because I've seen 150 and 200 points increase
Hmm.
with somebody that doesn't drink as much, starts lifting, gets more sunlight, better fruits and vegetables, sleep better, right? The sleep apnea thing was big.
Mhm.
I've seen 150 to 200 point jump.
Hmm.
And if that means that you can take less testosterone to achieve the levels you want, I've always believed the least amount of exogenous hormone you can put in, the better. Is that wrong? I mean,
Well, you might get even better efficacy at the dose you're at because we can't measure the actual receptor interaction with the hormone.
mm,
So if somebody's taking, 200 a week of tescipionate and they're like, well, I feel okay. All right. Well, if you start sleeping an extra hour per night, you give up the hot toddy every single night,
yeah.
and you treat your sleep apnea, we don't change your dosage. And then all of a sudden you're like, wow, I feel awesome.
Yeah.
And your
Yeah.
testosterone only went
Yeah.
up 20 points. Well, all right, then we got
Yeah.
everything else kind of spinning behind the scenes.
Yeah. Yeah. Is there anything you would say to that person who's like, hey, man, because I think there are a lot of men that want to look at testosterone. And it always doesn't have to be cypionate. I had a guy jump 400 points on DHA and Clomid.
Hmm.
400 points on DHA and Clomid.
Hmm.
His testosterone level came back at 932. I'm like,
Hmm.
bro, you're winning life right now. Like you
Yep.
feel great.
Yep.
Are there any other things that that a normal guy needs to make, or maybe even some warnings to make sure they're at the right place getting TRT, or what would you say to that person to?
I think if somebody's going after TRT because they're dealing with fatigue, they're writing it off to this in the same way that women write off thyroid for all their fatigue. And that's not, I'm not trying to throw gender stereotypes. I'm just saying I talk to a lot of people, and many times women will say, I need my thyroid check because I'm tired. And men will say, I need my testosterone check because I'm tired. And there's thousands of other things that can cause fatigue independent of both of those things.
Okay.
So that would be the first thing, that I wouldn't assume that it's a hormone problem, and I wouldn't assume that it's not a hormone problem either until you've checked it and checked the whole cascade. So check testosterone, check DHEA. If you really want to go down the rabbit hole, check pregnenolone, that's above DHEA. Check
Mhm.
cholesterol, that's above pregnenolone. So check the whole waterfall and figure out if anything's off within that waterfall. Or you can also check cortisol, ACTH, and see if some of that pregnenolone is getting shunted into stress hormones instead of sex
Yeah.
hormones like we talked about in the past.
Yeah.
So then if you've done that, you need to decide, okay, I know my testosterone's low. What age is this male? If he's past his reproductive years, then it's like, all right, well, if this is a decision that I'm going to make for the rest of my life, there are oral testosterones now.
Oh,
Insurance doesn't really cover them.
okay.
Bioavailability isn't as great as injections, obviously. Creams rub off on other people, spouses, friends, nephews, nieces, all those sort of things. All these things are just what you want to be thinking about. The third piece is, if you're in your reproductive years, you need to accept that it is a lifelong decision. There's a chance of infertility, provided your levels are well regulated and somebody doesn't overdose you and push you into too much estrogen and throw off the whole cycle. You might be able to keep the fertility, and maybe with a little bit of other things along with HCG and those sort of things, you might be fine. And I would say the last piece is, just because you hop on TRT doesn't mean you can forget about all the other stuff. So TRT doesn't give you an extra buffer to live your life and do whatever you want. You'll still feel terrible on TRT, and you'll still have poor body comp on TRT if you're not doing all the other things to take care of yourself.
I think that's one of the frustrating things with me when working with people is they think it's the magic bullet. And it can be it can really move the needle, right?
Mhm.
But it's not it's not your magic bullet, right? Um, how about females? Females in HRT. Is it the same? Are we talking about the same kind of thing? 43-year-old woman, paramedic, you know, wants to
Yeah.
get the hormones, wants to get on HRT. Is it the same conversation?
No, it's definitely different. So with women, in general, a woman shouldn't go through menopause before kind of late 40s, early 50s without some other precipitating factor. So if somebody's like 38 and they lose their cycle and doc's like, well, I guess you're just becoming menopausal early, that's not normal. There's no way, shape, or form that should be normal. So that's kind of the first thing, is recognizing when this hormone piece comes into the conversation. In a woman who is of reproductive age, in general, I wouldn't give her um, estrogen. I would consider, obviously, in like a birth control, it's a different conversation. This is like replacement of hormones
Hmm.
beyond a tiny amount for birth control. But sometimes low dose progesterone works really well in females. It doesn't throw off the cycle. It can help with anxiety, sleep,
Hmm.
and shutting the brain off at night. Um, but really, then we kind of have to work backwards and figure out, why isn't she making it? So always think, with all these hormones, if somebody's like, it's kind of the gas tank phenomenon. A lot of medical providers practice this way. Oh, vitamin D is low. We give you vitamin D and it fixes it. But we have to go higher up in that cascade. Testosterone's low. Why? Progesterone's low. Why? This is a normal female, normal anatomical structure. So is it a brain problem? Is it an organ problem? Is it a biochemical problem in the cascade? So that would kind of be the first piece that would come to mind with females. The second piece is, in general, women get written off from kind of like a perimenopausal, menopausal state of, oh, this is just menopause. This is how it is. The hot flashes, the lack of sleep, the constant anxiety, the treatment resistant depression. This is just menopause. This is just normal for life. And I think the interesting flip side of this conversation is, you talked about it earlier. You go to anywhere as a guy and you're like, well, I think my testosterone's low. Oh, here you go. Here's a shot for one time a week for the rest of your life. And a woman does that and they're like, I don't know. I guess it's just menopause. Completely, totally opposite, where men lose function of steroidal hormones. And it's like, sure, here's a prescription for the rest of your life. Women have the same thing happen. And many times they just get written off. So that would be the thing that I would advocate for women, especially advocate for yourself throughout the course of your life. But especially as you're going through that transition, one of the key things with menopause in females is as you start to lose gonadal production of sex hormones, a lot of that is made up by the adrenal glands, meaning that as you lose estrogen production and you get these big estrogen fluctuations that are associated with the hot flashes and vasomotor symptoms, that's because you're losing a consistent production of estrogen. And so a lot of that is if you have poor adrenal function, meaning adrenal insufficiency, not this adrenal fatigue where they burn out, but you have too much stress on the adrenal glands for too long, you can lose steroidogenesis from the adrenals directly. And so, as such, they can't make up the gaps in those fluctuations of estrogen. So, you get worse vasomotor symptoms. Now, conventional medicine will give things like antidepressants, and there's certain
Yeah.
medications that are cleared for these. Veoza is another one that fixes the hot flashes. But the key is okay, so what do I do with this information? The Rupa Health labs that we were just talking about for everybody, you can go on there and get a 4-point salivary cortisol, which strongly correlates with serum cortisol, gives us an idea of what does that cortisol curve look like throughout the day. If you're flat the whole day, that gives us a good indicator that, yeah, you're not making a whole lot of steroidogenesis from the adrenals, and you're in kind of this stage 3 of adrenal insufficiency where stage 1, you can mount a response to the stressor. Stage 2, you're hanging on, but it's getting tough. And then stage 3, everything's low. DHEA is low, cortisol is low. So you have no buffer with DHEA to kind of buffer cortisol, and then you have no DHEA to make testosterone. The other thing I would tell women is if you have low libido, you need your testosterone checked. A lot of women get estrogen and progesterone checked, but nobody checks testosterone and nobody wants to give women testosterone. And really, that's a key piece of the puzzle. Women are like, well, my body composition, well, no matter what I do, my body composition won't change. And I've got a number of different female patients now, young female patients. I've checked them low DHEA, low testosterone, reproductive age, childbearing years, multiple
How old are you
children,
talking?
29. That's one patient.
Okay.
And
How low?
how low?
15 to
Her-
70 is the number they say women, right? 15 to 70.
So the women's reference range for testosterone is they just changed it. I think it's 10 to 50 now currently. Her testosterone was less than 3. Her DHEA was
Buddy, no.
71,
At
um,
29?
Buddy,
71, and she's
no.
No, no,
29.
no. At 29 years old, yeah.
Yep. Yep. So again, super tired, super fatigued all the time. She was told she had Hashimoto's. We checked all the thyroid antibodies. She doesn't have Hashimoto's. She doesn't have a thyroid problem. Her thyroid's beautiful. So, point being, just because someone is tired doesn't necessarily mean it's their thyroid, but also you have all these other sex hormones that contribute to energy production and all these other things. Now, the other piece with women's hormone replacement is if there's a family history of uterine, cervical, breast cancer, even if it's not in you, but
Mhm.
if it's in other associated females in the family, there are many docs that are leery to give you that hormone replacement therapy. Same in males, if you've had a prior history of prostate cancer we may not want to give you testosterone therapy because there's some data suggesting of if you've got a little bit of that prostate cancer cell still left, it
Ooh.
might spur the growth. Right. So much of that data on testosterone was given when they gave testosterone to males with prostate cancer. It increased the growth of that prostate cancer because testosterone is androgenic. It promotes growth. It's anabolic. It promotes angiogenesis.
Mhm.
So further blood vessel development, further spread of this highly metabolic tumor. Now, when you give testosterone to people without prostate cancer, it doesn't insinuate prostate cancer. So it doesn't
Yep.
cause
It's got to
it, but
be
it
there.
correct. Now, that's the difference in men and women that you should get a PSA as a male before you start testosterone. You should get a testicular exam. And if you have an elevated PSA, you might not want to jump on TRT. As a woman, you probably should know your BRCA status. You should know your family status of all those different cancers. And then you should have a general hormone profile before you just hop on hormones. And so the only reason I'm bringing this up is there's many online providers now that people can go to
Yeah.
for whatever you want now, GLP-1s, hormones, you name it. Sometimes they'll check these things, other times they won't. If someone is prescribing hormones and they're doing it based off of urinary values alone, so if they're doing it based off of a Dutch test or they're doing it based off of salivary results, this is not helpful. So if
Okay.
somebody did the salivary cortisol swab that I was talking about earlier, and then they said, oh, I want to get on Cortef which is basically a prescription cortisone that you can take orally to replace the low cortisol. I would want to confirm with a low serum cortisol and a low ACTH saying, hey, the brain isn't telling the adrenals to make cortisol. Okay, maybe you're a candidate for Cortef. But if someone's prescribing based on either of those variables alone and they're not confirming in serum, I would be cautious about that as a patient.
We talked about it a little bit earlier. And I follow some people on social that are doctors that OBGYNs, they're having conversations like this with women. The number of women that they've talked about who will come in with these type of symptoms and, oh, this is just menopause. Here's an antidepressant and some ADHD medicine.
Mhm.
I mean, I don't know why that just it doesn't seem pragmatic to me,
Mhm.
Right.
right? You're in a way, it's almost like gaslighting women for going through menopause a little bit, right?
Yeah.
I would
And
argue that a piece of that is maybe because male doctors don't know what it's like to go through menopause, so it doesn't like, yeah, the symptoms suck as a woman, but they don't sound like life-threatening, you know? So they don't understand how it feels to be like super fatigued and moody and have hot flashes all the
Yeah,
time.
maybe there's not a lot, there's a little
There's
bit of
not a
apathy there,
connect.
a little bit of apathy
Yeah,
there, maybe. Yeah.
yeah.
and some of it too is some docs will tell you like, hey, if I run that test, what does a low pregnenolone mean? What do I do with that information? So it's kind of like they're not every single test that you order legally and your name's on it, you're responsible for the normal and the abnormal. So if you order it and it's abnormal and you don't know what to do with it, well, it could come back to bite you. So that's the other
Mhm.
piece too. Somebody's like, a reverse T3 is high. What do I do with that information? I'm
Yeah,
not going to order
I had a
that.
friend that saw a doctor looking and at TRT options and and it was actually a family friend. It was a doctor. And the family friend told him, "Hey, I really don't play in that area of medicine. It's not anything I'm good at, and it's not anything I'd be comfortable just at this point in my practice, but I can refer you to somebody else." I don't mind that answer.
Yeah,
I
absolutely.
respect that answer. It's a lot
Get
better than
involved.
now. I've heard a lot of doctors tell you they know when they don't, right? So I don't mind that answer. Um, this is a big subject that's getting more and more information to people. Getting blood work, their nutrition, their diet, how to affect their blood work, their supplements, hormone replacement. We did have somebody ask this, and I wanted to have this conversation because me and Gray have had this conversation. Um, I off and on will measure HRV,
Mhm.
Hmm.
and I'm in the 50s, low 50s. And I remember I was like, and then I told Mike, I told you that, and you're like, hey, dude, for your age, 50 is actually pretty decent,
Mhm.
right? Um, and then I have people that, and I have clients that'll ask me, this is my HRV, how do I improve it? Man, I've worked really hard at improving my HRV, and I can't get that thing to move. Like, it's really hard
Mhm.
to get your HRV to move. It's almost like I almost feel like, well, maybe it's one of those things I needed to catch it before it got low, right? Before I have to drive it back up. But man, me and a buddy of mine were doing much more HR or zone two work, looking at sleep, sleep timing, what we eat before our sleep, how often we're getting in zone three in jujitsu, zone two jujitsu. No effect. If somebody really wants to improve the HRV, can you quickly explain the fifth grade version of what HRV is even is, why it's important, and what can you really do to get it to move?
Mhm. Yeah, so everybody has two branches of their nervous system. So you got this fight and flight, which is the stress side, and you've got this rest and digest. And that's sympathetic and parasympathetic. HRV is you can think of it like a meter. So how far on this side are we? How far on this
Oh,
side are
that's a
we?
great way to talk about it.
And we
Yeah.
fluctuate back and forth all day long. So you're in commuter traffic, you're living in fight or flight, you're listening to Run DMZ and you're even more fight or flight. You hit that pre-workout and you're maxing out. Then, ideally, you sit down to eat a meal, you should shift back. So if you live on this side all the time, with the sympathetic, the fight or flight, you're gonna have a low HRV. If you live on this side, you're going to have a high HRV parasympathetic. But the goal is not one side or the other entirely. It's flexibility to switch back and forth when we need it. So HRV is heart rate variability. The space in between every single heartbeat should vary over the course of the day. So when you get stressed out, your heart beats faster and there's less space and there's less difference in the spacing throughout the day. As you relax, that heart beats slower. And so we have more variability in between beats. That's normal. So, HRV is a window into the nervous system, essentially. What matters more is not a one-time measurement of HRV, it's the trend change in HRV. So, when I was at ETSU and we were tracking all these things on players, you could see a strong correlation with somebody's HRV dropping off and their rate of force development as measured in a force plate dropping off too. So, middle
Oh,
of the season. So, that being said, it doesn't matter. HRV doesn't matter as much for the general population from a performance standpoint, just because we don't really have major metrics. But if you're seeing a consistently low trend in your HRV, number one, have you been assessed for sleep apnea? A third of people normal body weight have sleep apnea, independent of whether or not they perceive it or not. You can buy these rings online. We've talked about looky rings. I tell people use it for a week, get your information and send it back, get your refund. Use it for what you need it for, or you can get your doctor to do this at-home sleep study. Super simple. That's the first thing. Fix that if you've got it. The second thing is, I've definitely seen you guys were part of that little grounding sleep study that we did.
hmm.
So people that aren't familiar with grounding, is basically the idea the more time you spend in contact with the earth, the more you have an electron exchange in terms of absorption of electrons. And there's good data in humans on lowering inflammatory markers like C-reactive protein, ESR, erythrocyte sedimentation rate. It's based out of UCLA if people want to look into it. So I have seen increased time spent grounding, increase people's HRV most of the time when people go on vacation. So again, less
How
stress.
long? How long?
Well, again, most people are on vacation anywhere from like 3 to 7 days, but
Oh, okay.
it doesn't have to be that long. I would be willing to wager you could see a small bump with daily usage, but it's all about practicality for people. So that kind of be the second thing. The third thing that's going to tank HRV is alcohol. Anytime you drink alcohol, it increases nocturnal um, fragmentation, sleep fragmentation. So basically, you wake up more, you spend less time in deep sleep and REM sleep, independent of your perception of those awakenings. You won't remember them. You'll just basically spend less time in those deep stages and more time in those light stages. So that will for sure worsen HRV for almost everybody across the board. I would say 99% of humans. Fourth thing that's going to worsen it, and subsequently, if you want to improve it, is changing your timing of your caffeine. So no caffeine after 2. If you're a slow metabolizer, no caffeine after noon. And then you can certainly downregulate the nervous system at night. Some people are like, my brain is always on, it just won't shut off. As soon as I lay down, boom, it's going 100 miles an hour. So this is where you can take things that increase binding to the GABA receptor, magnesium, specifically magnesium glycinate or threonate. If you want to cross the blood-brain barrier, you can do L-theanine, you can do valerian root. Um, you can do zinc has some good data in this is why ZMA works well. They both
Yeah.
modulate
Whew.
glutamate. So
DMA
GABA,
does a number on me at night.
yep. So
Bro, I
GABA,
sleep, but I dream. Crazy
right,
dreams. Almost
right.
to the point where I feel like I can't sleep good enough because I dream so much. Does that make
Hmm.
sense?
That's how melatonin is for me. I can't do
Yep.
it.
hmm.
Yep. So it regulates
Intense.
glutamate signaling, which is an excitatory neurotransmitter, and GABA is the other half of that. The other one that people sleep on is glycine. Glycine's super high in collagen. I had a patient
Mhm.
recently that she said, yeah, I couldn't really figure it out. I couldn't really sleep well. And then I started drinking collagen at night, and all my joint pain went away, and I could actually fall asleep. And I was like,
That's
oh,
what we got to get.
it's the glycine.
Yeah, we
Collagen.
got, yeah,
Yeah.
yeah. Um, that's one thing I want to try in our house was, uh, what did you just say?
Glycine,
No,
collagen.
collagen powder.
Collagen. Yes,
Collagen
actually
powder.
same. It's been on my list.
Yeah, that's on my list. I'm glad you said that.
Hmm.
You don't have to
Um,
take it in a supplemental form. I always tell people you can buy bone broth at the store, and it's got a
Yeah.
high collagen amino acid profile.
That's why I haven't bought it because I do a thing of bone broth every week.
Yep.
So
Put it in your rice,
yep,
put it
yeah.
in your
that's what we
pasta, put
do.
it in your
Yep,
chilies, all that stuff.
that's what we
Um,
do.
the one thing I mentioned to my client, I forgot to tell you, one of the things that did start to move was HRV, decreasing caffeine and started taking adrenal cortex from Thorne. One of the
Yep.
ones you recommended for me
Yep.
that you helped me lower caffeine on,
Yep.
which was one of those things where I almost subconsciously drank less caffeine.
Yep.
Like I almost didn't even think. about it. And then you hit me up one day and you were like, hey, how's that adrenal cortex and caffeine? I'm like, oh yeah.
I always tell people when you start supplements are not like drugs and that it'll be 2 to 4 weeks and you'll be into taking the supplement and you'll be like, oh, I guess things have gotten better. And
No,
that's
it's
exactly what you
different.
just said. It's what Rachel said. And
Yeah.
then
Yeah.
the way you're going to
Yeah.
know if it
Rachel said the
actually had
same
an
thing. Yeah.
effect is when you stop it. And you're going to be like, oh,
Well, that's what happened. That's what happened here. Um, Rachel ran out and the joint pain, and I mean, like she got mad at me.
Mm.
We're never going to run out of that again. Never going to run out. Never going to run out again. And she went back and that's how it worked here was like, okay, you get off it, now you know. And my client actually was like, this adrenal cortex doesn't do anything. So I said, oh, quit. And then another client of mine did that with the BPC
mhm.
and not do anything, and he quit. And I was like, shoulder, oh my God. Okay, well then we know,
It
like,
was working.
yeah, it was working,
Well,
right?
I think a lot of people want to feel like totally transformed when they start something. And I have to remind people, like you said, it takes a few weeks for stuff to kick in, but also like really pay attention to the small stuff that used to nag you a little bit. Like if you woke up in the middle of the night for 10 minutes and now it's only like you don't wake up in the middle of the night, that's obviously an improvement. Like look for the little small stuff
I say the same
when
thing
you're
when
starting this.
guys start TRT. They're like
Hmm.
2 weeks into. I'm like, dude, I'm not. I'm like, holy, like I'm not. I'm so, like I don't see really major gym changes yet, and like I'm not 5% yet. I'm like, bro,
It's like, bro, it's been 2 weeks.
yeah, bro, it's been 2 weeks, man,
Literally been
right?
2 weeks.
And I imagine people are like that on GLPs, right? They'll 3 weeks into GLPs, I'm like, I'm not down 30 pounds,
Right.
In 3 weeks. That's
right? I'm
so
not down 30
crazy.
pounds. Um, the best thing about you, Mike, getting this job is that we could probably do this more often.
Mhm.
um, and really integrate you with people in our group, in our Facebook group, and our friends, and just people that we care about, right? We had a friend of me and Rachel's, a really good friend of me and Rachel's that asked us about seeing you, and she's watched some of our videos, and I'm like, that's right. So one thing we can do with this podcast is one, we can put it on our group page and link it on our group page.
Hmm.
People can get information on how to see you. Our clients can see you. Move. So many people I've talked to I've been like, yeah, but it's Greenville. They're like, we don't care. We're going through such horrible situations just from health wise. Nobody will talk to us. Like, we
Mhm.
Yeah.
can't get conversations with people about our health. It's labs and prescriptions, labs and prescriptions, labs and prescriptions. And man, there really is a change in our culture. I mean, Peter Thiel was on 60 Minutes.
Mhm.
We're crying out loud. Peter Thiel was on 60 Minutes. I don't know how long I've been following that guy, right?
Mhm.
Um, So I'm just like, wow, people like that people are looking at different ways, man. People want help.
Mhm.
People want a different form of what medicine is these days. They really do.
People, well,
They want
they don't want to feel
healthcare.
like shit anymore. That's the whole thing is people, we've now like created the conversation, like what you've always said, Mike, there's common versus normal,
Mhm.
right? So it
Yeah.
might be common, but it's not normal. And people are waking up to like, okay, I do commonly feel like this, but it's not normal for me to feel this way. It's not normal for me to feel fatigued, right? It's not normal for me to not be able to lose weight with a
I
calorie
think
deficit, right?
people also don't want to go down the you use the word cascade.
Hmm.
The prescription cascade.
Mhm.
Good friend of mine that does jujitsu hit me up, got some blood work done, and the doctor recommended drugs. And he's like, "Hey, man," I said, "I'm not going to go against what your doctor says, so let's just get rid of that. But we can be a friend and have a conversation." He goes,
Mhm.
"Perfect, right?" I always got to say that, right?
Hmm.
And I was like, he's like, "I don't want to go down because I feel like once I start one thing, they're going to do the next thing, they're going to do the next thing, and then it's going to do the next thing, and now I'm on all these medicines, and I'm definitely not going to be healthier." It's like I use the example I use is when the medicine came out to make people who use pain pills poop more. I'm like, well, why are we figure out why we're addicted on pain pill? Like, um, opioid constip to help with opioid constipation. I'm like, whoa, what? Let's can we talk? You just skimmed through that real important part,
Hmm.
right? The opioid side. Can we go back to that again? Right?
Yeah.
Um, but this is going to help a lot of people. We will post on every time we post this clip and we post this, we'll get from you how to get in touch with you, the name of your place, post this lab. If you're catching this podcast late, go back to the beginning and Mike talked about a platform they built to get labs run. And this is the definition of being your own advocating for
Mhm.
yourself is being in charge of your own labs, getting labs and seeing your labs, having your labs, owning your labs, and then have a conversation with somebody like you about what do these labs mean and what does it mean I have what can I do not just from a medication side because there is value there. I don't want somebody to hear me not say there is value in medications. There are people that need medications, but there are lifestyle changes that can go along with that that can give you a better life,
Right.
right?
Right.
And reduce your needs for those
And
medications.
yeah,
Exactly.
and I always feel like the job of when you get on medications is to change your lifestyle enough to where you can get off those medications, right? Um, so I appreciate it, man. Thank you guys for coming on. We appreciate it
Yeah,
as
thanks,
always.
Mike.
Absolutely.
Bye.